North Carolina began an effort to create a more achievement-focused child welfare system in 2009. The effort was called REAP, Reaching for Excellence and Accountability in Practice. In January 2011, 8 county departments of social services began piloting REAP as a continuous quality improvement approach. In this video, leaders from 2 of those pilot counties shared their insights about how agencies can successfully prepare for and implement a CQI approach in child welfare.
Can you tell us about what you have done to change your agency and community climate around using data?
We always gathered data in-house, and now we're actually showing it to people. Instead of management just looking at it, interpreting it, now we're showing it to the line staff. And for the first time, we're showing it to our community partners. Information from our CFSR, we put it out there for our community partners. And from the data dashboard, we put it out there. So everyone from our board of directors to our line staff, to our supervisors, to our community is aware of what's going on in Scotland County CPS now.
So just trying to get that part across, that data isn't the story. It just helps you explain or to expand upon the story, and to also give you, the knowledge that you are actually having an effect. And just trying to get that understanding that data is not the enemy, that, data is something to help you justify, to help you show that what you're doing works.
Can you talk a little more specifically about some of the challenges you might have had with your staff, maybe having some negative associations with data, not feeling comfortable with using data? What have you done, or what would you do differently next time to address some of those concerns that your staff specifically might have?
I've seen with staff and showing them the data, making sure they understand what they're seeing, not just handing them the dashboard and reading the numbers through, but make sure they understand where the data is coming from. For example, this isn't last month's numbers. This could be 3 quarters ago that we're looking at. And making sure they understand where it came from, how it was derived, and what it really means is one thing that we could do. They want to change or want to improve practice, but the steps to get there, they may be hesitant to take those steps. It may create more work now, and so everybody can be hesitant to having to do more work, but in the long run, it's going to pay off, and in the long run probably mean less work.
Where I see the buy-in from staff more into the data and the outcomes is whether those strategies that we're implementing, those initiatives that we're implementing are paying off. That they can actually see some results from that, like our parent partners, like moving forward with a fatherhood initiative, like our meetings with the court. They are making a difference, and at the end you see some impact on that data. But it's those kinds of things that they can buy into. It's not the numbers so much, but they sure like the outcomes when they change. But that helps to really change the culture of the agency when staff can be really engaged. They become your true partners. Frontline staff are beginning to see how when you staff a case, you're talking about outcomes. Because when you, just like what you said in terms of implementation, how do you make that real to a frontline social worker who's working with a family, to be asking those questions, what outcomes do I want for this family? And how do those relate to those big outcomes on that dashboard? And I'm beginning to see that, take hold.
What are some of the specific skills and knowledge that you think are necessary to build capacity in your staff for this type of achievement-focused work?
I would have done so much more with staff to get them ready, and to get them ready to be in a culture of change and to move forward. And like Robbie said, to identify things that we've done for years that are just stagnant. They're not terrible, they're not great, but we could just do so much better. And so I agree. I don't know that there's a skill to put your finger on. I really think it's what kind of culture is in your unit, and how willing are they to change and to move forward.
We are so compliance focused. So that culture, we're trying to change that to an outcome focus instead of being compliant. They're coming down to look at our numbers. They're coming down, so it's just not about just being compliant to all of that. And are you? Because some of this work is really hard, and some of those outcomes aren't, you're not going to see change overnight. It's a process. And that's one thing about REAP, was to learn to be really flexible and patient and want to learn, because it isn't something that comes in a manual and say, go do it, and in 12 months you should be all set. I learned a very valuable thing when we were doing some training with the state of Iowa, and she told me about the third, and a third. Stay focused. A third of your staff is going to go with you immediately. A third is going to come along, and that bottom third is going to be tough. But stay focused and stay the course. I think it does pay off, and don't get discouraged.
Well, and one thing I've tried to do is go into the staffings or their staff meetings and really continue to encourage them. They don't see the attention Scotland County is getting right now regarding this REAP process and the numbers that have changed. They don't see that every day, and so I think we have to remember to remind them that they're doing great work, to encourage that, and those things that we put into place, that they're working. They are working, and people are noticing. In our county, they're noticing, and across the state, they're noticing.
If a new REAP county were coming on and we had some supervisors or program managers, what might it look like in their agency if they were going to, thinking about what you would do differently? What would you see if you went to their agency and they were just starting that process of getting their staff comfortable with REAP, with looking at data more?
The way we went into it, I expected and hoped that one person could make this happen. In other words, to start the process. And I got lucky. April was there, and so she was willing to jump in and take that, and she's strong in leadership. But with any time in the future, I would really like to put together more of a team of management and direct care. Not so much, I know we reach out to the community and we make this big group, but to support that individual. Because I think about trying to understand the data, trying to do the training, trying to get all this out, leaving that on one person's head or just, a couple people, is a lot of work. And it probably made it a lot more difficult than it had to be. And the concept of continual quality improvement, or moving forward and constantly reinventing what you need to reinvent, but keeping the message the same, that part of the concept when we first went into it was not there. We've been in this for a while, and I know I can count hundreds of different initiatives that we've done, and that's not bad, but evaluating them, improving them, enhancing them, continuing them, that's the difference. That's the piece we're missing.
Another area of readiness is making changes to your agency system and structures by considering things like time management, staff assignments, procedures, policies. What have you changed in your system to make data and results more a part of how you do business?
We're asking different questions, and those questions are outcome based. Instead of a worker staffing a case and just telling us what's going on with the child, now we're asking, what did you do towards meeting that permanent plan, whatever that plan may be, and what is the concurrent plan, and what have you done towards that concurrent plan? So the questions are being asked, not to put someone on the spot, but to ensure it is in their mind that is always what you're working towards.
And as a director, when we went into this, the only thing I could tell them was that, we'll be willing to change, to restructure for what you need. This isn't a fixed system anymore. If you need to change, and as they've gone along, they've changed how their teams work, they've changed the structure of their meetings and when they meet, and they've identified resources that they don't have, those kind of things. Now, I couldn't go in and promise them I'm going to give you X amount of dollars because, number one, we don't have them. But, you come with a need, you've identified that need, and, we now have an outcome and we can show how that affects that. I can make a commitment to see if we can meet that resource. Maybe we can move something around. Maybe we can make a new community partner. This year alone, we've done 14 adoptions for 2012. Okay, doesn't sound much if you're in a big county, but for us, our average was 6. Okay, we had a backlog of cases that, we went from 82 children in foster care down to about 45, okay, within less than 12 months. That generated some revenue that now we've reinvested. By adoption incentive money, we had not received money in years for adoption incentive because we couldn't meet our threshold. Okay, so we couldn't meet that number. We've met it now. Now we have, more money, resources. That what did we do with it? We turned it around and we made these contracts with the therapists. We had a real need for mental health services that we couldn't get. April had the freedom then to go out and go find a therapist that we now bring in that is contracted just to do this service because we couldn't get it. We couldn't, so we brought it to them.
One thing that sticks out for me is the restriction of time. We've seen our foster care caseload almost be cut in half. And now you see the foster care workers, they can breathe and they can do quality work with the children on their caseload.
The less children we have in care, we can kind of redesign and reinvest what workers are doing in initiatives that really make a difference, and look at how to realign those resources within our own organization, which is, at the end of the day, is a heck of a lot of fun.
If you could give some examples on the meeting structure or how the role that data plays in meetings.
We bring our PPAT team together, any case that's reunification, every 3 months versus the standard 6 months. So the team's there and we can review the case to see if we're making any progress, if we're not, and if anybody has obviously more suggestions for progress. And then we make sure we hear it in the court also, at least every 3 months, if it's a reunification case.
That cost us a little bit of time and manpower, but it showed us, through the data, through what we were doing, that it was worthwhile.
But as far as the sustainability within the culture of the agency, it's now something we like to talk about when we are interviewing new applicants. That we're an outcome-focused, achievement-focused child welfare organization. Talk about it from at the very front door to the people that are applying. And plus, I've woven it into performance evaluations in terms of developmental goal and talking about, opportunities, webinars, and talking about the data and taking part in opportunities to learn more about the data.
You've talked some about some of the messages and the way you've used data to engage community partners. Could you talk a little bit about how you did select which community partners to engage and when to engage them and what role to ask of them?
We have such a stigma. Like Robbie said, people would just turn the radio off. They don't want to hear any more about any service that's going on at DSS for that matter. But when they hear that we've dropped this many kids out of care in 6 months and the amount of money we've saved this county, maybe they'll listen again. We got the community in at the beginning. Before we ever did a self-assessment, we had a meeting. We explained what we thought the process was going to be at the time. And then we broke down into subcommittees based on their interest. They picked the subcommittee they wanted to do, and also based on the 4 major areas we wanted to work on.
We knew the areas that we kind of wanted to focus on, which were year to permanency, placement stability, and disproportionality and disparity within the system. So we were very intentional about the stakeholders that we chose. Our biggest stakeholder that we're working with and chose is the courts. Mental health we're collaborating with, and law enforcement. But yes, it isn't all about money sometimes, but it's how we realign, how we work with one another. It's simple things like right now in Pitt County, our court, family court administrator and one of our judges are they're rearranging the courtroom to be more family friendly. Things like that end up with some changes in how you end up working differently together for an outcome.
You mentioned for both of your counties having some ideas ahead of time of where your priorities were and where you wanted the community's help. Can you talk a little bit about how you selected those priorities?
We knew we had some issues that were glaring, that were out there, and that would be the best place to start. And so when we had our community partnership, we laid those out there, and we wanted to make sure those were up there because we knew those were issues. They had to be addressed before you really did anything else. We knew that was the goal we wanted, and then we let the community say, okay, what else do we need? What else?
But again, some of those outcomes are intertwined with one another.
Right.
What you do in one or don't do in one affects another one. So I think, again, if you understand how those outcomes work together, that helps you, focus in more so on some of your hot spots, because you go, if we can make a difference in this, we're going to see a difference in this.
Knowing that a lot of things are interrelated, what made you hone in on sort of those three as your starting points?
We've been working on the front end and understanding where in the community our referrals come from, doing a lot of work in that data. We've narrowed down to 3 areas in the county. That was with a couple surprises. One of the areas in our county where a lot of referrals come from is one of our townships in the county, but a lot of them come from grandparents, not parents. So, that tells us, what is it we need to be doing in that community to possibly respond getting ready to do some focus groups in those areas again, because what they tell us is important data. We can't do it without them.
North Carolina's REAP project expands to additional counties in January 2013. For more information, please visit the North Carolina Division of Social Services website.